You know, if you had seen me in mask and wearing a suit like this back in 2019, you would have called an ambulance straight away because you thought that I was sick. Who knows, now in 2021, you actually have to have a mask and you actually have to mask up everywhere you go. In 2020, the phrase COVID-19 came into being, which was never mentioned before. And since then, there had been many other phrases that we use in our normal conversations, such as SHN, QO, MCO, circuit breaker, hammering down the infection curve. These are now normal terms in our day-to-day conversations. In May 2020, as we were coming out of the circuit breaker, I remember developing a set of scenarios in post-COVID environment. And I looked at a normal plus environment whereby we would be returning to normalcy, or even a hyper-normal environment where it is always almost like what we had before, pre-COVID. However, to be prudent, I did include another scenario called normal minus. And this normal minus scenario will kick in when the infection rates start to rise again. Recent spikes in community cases associated with inbound visitors and also in the community has required the government to relook at what additional safety measures needed to be implemented, almost like returning back to phase 2. I'm so glad that this broadcast is arranged to discuss this very important topic. Stay tuned. Thank you very much.
The NUS Museum is the oldest university museum in Singapore. It is located within the main campus of the National University of Singapore in southwest Singapore at Kent Ridge. The collections include Chinese, Indian, and Southeast Asian materials consisting of traditional sculptures and paintings, bronzes, jades, ceramics, textiles, and modern and contemporary art. Since 2006, Ahmad Mashadi has been the head of museum. The roots of the NUS Museum can be traced back to its establishment in 1955 at the University Art Museum at the then University of Malaya, located in the Bukit Timah campus. The status of the museum and its collections have evolved over time before reaching its current form today. The NUS Museum has over 8,000 artifacts and artworks divided across 4 collections. Donors to the collections include Lee Sang-Ti and the late Ng Eng Teng. Other donations include the straight Chinese materials received from Ms. Agnes Tang. They consist of furniture, ceramics, paintings, and items related to the social history of the Chronicons. If you want to know more, head down to the NUS Museum.
Good afternoon, my name is Athena Tan. I am pleased to welcome you to the webinar on COVID-19 Response Against Resurgence. To our loyal followers of the Phoenix series, thank you for joining us again. Our 4th episode, which is a special episode quickly put together in response to the latest COVID-19 development in Singapore, addresses some commonly asked questions surrounding the recent rise in community cases, vaccinations, and more. Without further ado, let me introduce our first speaker, Prof. Benjamin Ong, Senior Vice President of National University of Singapore and Senior Consultant Neurologist at National University Hospital. Professor Benjamin Ong has been active in postgraduate medicine education and the development of IT in healthcare. He also worked on process improvement in patient care. He has held various leadership positions, including Chairman of the Medical Board of the National University Hospital and Chief Executive of the National University Health System. Prof. Benjamin Ong served as Director of Medical Services, Singapore from 2014 to January 2020 and received the Meritorious Service Medal in 2020. Our first question is on serology testing, and there are 2 parts to this question. Firstly, could you explain what a serology test is? And secondly, will the results of the serology test be different when tested on a person who has been vaccinated?
Okay, there are different types of tests to help us to make a decision pertaining to an individual who presents to you with COVID-19 infection. Because there are some patients that might turn up who don't have symptoms or have very minimal symptoms, and there can be other conditions that mimic COVID. We sometimes also do a serology test together with the test that we use to detect the presence of the virus. So the tests that we use to detect the presence of the virus are the ones that many of us know about, which is the PCR test that looks for the virus, remnants of the virus. We also have the antigen rapid test that also help to detect the presence of the virus. But beyond that, the serology tests look for our immune response to infection. And these take a number of forms. There is, of course, the antibody response or the humoral response that the serology tests look for. There are other forms of immune response that we have as well that need a more sophisticated lab setup to do. But a positive serology usually tells us that the infection has been there for some time. We're not able to date it accurately, but we're able to tell that it is some time back, in essence. We do know that in patients who are naive to COVID, when they pick up the infection, it takes some time for the initial serology test to become positive, usually only into the second week or so. So by detecting a serology test, you know that the person was infected some time back. It is also possible for us to trace sequentially or serially the level of the serology to tell whether or not the individual may be recovered some time ago. One point I wanted to add, which is something that many of us may not be aware of. If you get yourself vaccinated, your serology usually will also test positive. But you should be negative for presence of the virus on PCR testing. The interesting thing, of course, is that with the mRNA vaccines, or later on when we have the protein subunit vaccines that come on board, hopefully sometime in the future, these actually generate antibodies to the spike protein. So you can tell the difference between a new infection and a person who's been vaccinated by looking for antibodies to different components of the virus. Presence of a spike protein and antibody in a person who's been previously vaccinated is expected. It shows that the vaccine is doing its job. So I hope that explanation is actually helpful to let you know a little bit about why we deploy serology tests as well.
9 COVID-19 cases of the TTSH clusters were fully vaccinated and had mild to no symptoms. In recent weeks, the safety as well as the efficacy of the COVID-19 vaccine has been thrown into the spotlight. What are your thoughts about it?
Thank you. That's a great question. One must be cautious about drawing conclusions when you look at data of this nature because you're seeing it without an understanding of the denominator. In other words, the ones that have been exposed, that have been vaccinated. So seeing 9 cases need not be a cause of concern if the rest of the fairly large cohort of individuals that were also exposed in that same setting in Tan Tock Seng were actually all right after a period of time. And I think you've heard recently from the ministry that there have been no more identified cases to date. And from today, and that is the 18th, Tan Tock Seng will gradually start to resume its activities.
In light of the recent rise in community cases, Singapore has effectively dialed back to phase 2 from 8th of May with further restrictions effective from 16th of May. Is this CB 2.0? What additional measures do you think must be in place before we can dial forward to phase 3 once more?
We do need to watch what happens overall in the environment in Singapore in and of itself. To begin with, we've only just started the measures that have hopefully reduced the social mixing. We have allowed some essential activities to continue. And the hope is essentially with the reduction in social mixing, the spread of COVID-19 in our population will be curtailed. It will take some time for the impact or effect of such changes to be felt. It may take a couple of weeks before we actually see changes in actual numbers. Meantime, because we have a fair number of people under quarantine, already, we will possibly see more emerging cases from those that are under quarantine. Moreover, I would watch the unlinked cases very closely, because these are cases that tell us where else we need to search potentially for exposure risks, as well as individuals and groups that may have been exposed to the individuals that are unlinked at present.
Is the situation at TTSH under control? What are the measures in place to maintain essential healthcare services to handle non-COVID-19 cases during this period?
That's also a very important question. In any management of a pandemic of this nature, one of the key things that you try very hard to do is to preserve your healthcare resources so that they can provide not only for the cases with COVID-19 infection who need it, but for the business as usual that's important. Illness and health-seeking behavior do not stop just because we are in the midst of a pandemic per se. And I think that's something that we need to keep in mind. So what has been done since this has occurred is an enhancement of the current measures that we have to minimize the likelihood that there will be spread. As you might have heard in the press, all healthcare workers now, and particularly in Tan Tock Seng, have had to undergo a screening with the swabs. And many of them have been put under isolation pending the results of the swabbing. Tan Tock Seng is also extended their search for potential leaks from these particular wards that have been impacted by doing so widely throughout the whole campus. Patients themselves that have been in the ward itself, all their relatives or loved ones that have visited them have also been traced to try to catch anyone that potentially has been exposed during this particular period of time. Moreover, some of the measures that were put in place during the circuit breaker earlier on have been reinstated, not only in Tan Tock Seng, but in every hospital. That is, you cannot move your staff between hospitals, and every staff in every hospital has had to undergo a swab screen and will probably undergo routine screening subsequently as well. There's also been a change that's been instituted by the MOH to the protective measures that are taken, and a change in the way in which we will be screening for potential cases of COVID beyond just at the door, also periodically, as Tan Tock Seng has announced as well, while they're in the hospital itself. The final comment that I will make here is that while it might not be that comfortable, patients that are inpatients in Tan Tock Seng and in other hospitals will be asked to actually wear masks while they're there, so that there is less aerosolization within the ward setting itself. These are the measures that have been put in place, and for many doctors and healthcare workers, it actually sounds like circuit breaker. So the stance in the healthcare setting is to try and preserve it. Moreover, we also have backup plans to build up isolation capacity, and we were able to temporarily stop the inflow of emergency cases to Tan Tock Seng to give them a chance to get the situation under control. Of course, this has created some stresses in the other hospitals, but this is still within the ability of our system to cope at present.
I know this is a tough question, but a lot of us are eager to know. When do you foresee the day that we do not need to mask up?
That's a great question. And I'm not sure I'm a very good person at predicting what the future looks like. I'm hoping that at some stage within Singapore, at any rate, the number of people who are vaccinated is high enough such that in many settings, we will be able to relax our guard. But I think the important point that this current surge in cases is teaching us is that we, as a country, who need our borders to be open for our economy, will always have to be cautious so long as COVID remains a challenge in countries around us, which we trade with and where we actually have exchange of people. So that is one of the factors that we need to be cautious about. I'm sure you're aware that not only we, but even Taiwan and even Hong Kong are also dealing with periodic issues of this nature. And there are similarities in the way in which it's played out in all those countries as well. So I won't try to predict when that happens. I would just encourage everyone who has been offered a chance to be vaccinated to get vaccinated as soon as possible, because we do know that vaccination does offer personal protection from getting infected.
Just a final question, Professor Ong. Any concluding thoughts for our Phoenix audience?
So there are a couple of things that I thought, if I have the opportunity, I could share with our community. One is that we are at a critical time. So it's quite important that we all do our part, because to control this pandemic, apart from following the instructions, we need to understand what is meant by reducing our interactions. For this period of time, although it's very tough, we should try to minimize our person-to-person or social interactions, what is called social distancing. So the intent essentially of the tightened measures, and if we have to tighten even further, really is to reduce the mixing to the bare minimum. And if one can actually try and follow that, I think we will have a better chance of getting this under control fast. In addition, compared to last year, we do have vaccines available. So once the offer comes, I would encourage everyone who is eligible to avail yourself of the vaccinations that will be offered. What we also have as an advantage this time around compared to last time is that the majority of our healthcare workers have been vaccinated, fully vaccinated, and a very large proportion of our older individuals have also been vaccinated to date. These are actually very useful because it gives that protection that is needed, and hopefully we don't see the serious cases we used to see last year amongst those that have been vaccinated.
Dr. Pek Tien Wan is the Senior Director of the Office of Safety, Health and Environment, OSHE, at the National University of Singapore. He is responsible for development of safety and health policies, and he oversees the implementation of the university's safety and health management system. In his role as the NUS Crisis and Emergency Management CEM Director, he established the NUS CEM framework and he manages critical incidents. He is qualified as a Business Continuity Certified Expert, BCCE, and a Crisis Management Certified Expert, CMCE, by the Business Continuity Management Institute. Dr. Pek was awarded the Public Administration Medal Bronze in 2012 and the Public Administration Medal Silver in 2019. Recently, COVID-19 cases were reported in NUS. How much of NUS current safety measures played a part in ensuring that no clusters were reported on campus? Dr. Pek, please.
Well, the current safe management measures that we have implemented are as follows. Firstly, we have to prevent the infection from taking place. And these are the measures that we have put in place. One, everybody must wear the mask, face mask. Classes are held in groups of less than 50. That's the face-to-face classes. Back then, it was group of 8. Group of 8 people can get together as a group to do group work. That was subsequently reduced to 5, and more recently, that's reduced down to 2. Individuals are expected to be separated by a distance of 1 meter. And we emphasize on hand hygiene. Everybody's supposed to do the health and temperature declaration. In terms of facilities management, our Office of Facilities Management has stepped up the cleaning regime. And we have also applied antimicrobial coatings on high-touch surfaces. The second measure that we have put in place is what I call reconnaissance, surveillance. We have a surveillance regime. We survey and we take note of the places which are heavily, densely occupied. We monitor the occupancy rates of our canteens, and we put in timely intervention measures to ensure that our canteens are not overcrowded. During the initial phases, when our canteens are opened up for dining, we monitor the occupancy, and we put in place we open up additional spaces for people to consume their food. And as a result of that, we're able to bring the crowd density down to an acceptable level. We also conduct testing of wastewater from our hostels. That is to enable us to pick up early signs of an infection. The third R in terms of our current management measure is response. If a positive case is detected, or if they are close contacts with a confirmed case, we act very quickly by means of contact tracing, to identify the individual, to ring fence around the people who have been in close contact with them, so that they can be served the stay home notice. And that's how we respond in a quick and fast manner. So we have these systems in place to help us, and that increase our speed of response. And that, I would say, it minimizes the contact between the infected person and the community. I would say that has in some way helped us to minimize the spread of COVID-19 cases on campus. But the strength of the system is as strong as the weakest link. There are many, many things that we need to manage in a pandemic like this. And if the weakest link is not managed well, that could be the cause of our down. We react to a pandemic like this, we have to act very fast, and we have to quickly address gaps in our system so that it can be as robust as possible.
Singapore authorities are now studying airflow and ventilation at TTSH to better understand the spread of COVID-19. On the same note, will NUS be doing the same?
Well, there's no need to really reinvent the wheel. A whole community of scientists around the world are investigating on this issue. So for us, what we need to do is to leverage on the research and the work done by others. I would like to share that WHO has published a document called the Roadmap to Improve and Ensure Good Indoor Air Ventilation in the context of COVID-19. And that's developed by a team of scientists from around the world. And it's called the Environmental and Engineering Control Expert Advisory Panel, or ECAP for short. So we have a group of scientists that's looking at this. So we learn from their work, and we try to implement whatever that's applicable to us. Now, how about some areas in which there's no publication done, there's no work done? In those areas, then we do our own research. So I'm glad to inform you that we have teamed up with the School of Design and Environment to do computational flow dynamic studies on the impact of using table partitions in our canteens to minimize droplet transmission. That was started in the early days last year, when we were deciding whether we should open up the canteens for dining. And I wasn't sure then how many people will dine in our canteens, and whether our canteens will be overcrowded and will be under pressure now to accommodate more people than what the safe distancing measure would allow. So that will, and one alternative is to put in partitions. Perhaps with partitions, we could then put more people closer together. So we did our own research in that area. So where there's research already done, we leverage on the research done. In areas where research is not done, and in areas where we need to find a solution for ourselves, these are the areas that we will invest our resources to do our own research.
With further tightening of safety measures, and some have called it CB 2.0, how might NUS respond differently compared to the first circuit breaker?
In the first circuit breaker period, that was from 7th of April to 1st of June, several measures were put in place. These include like closing of workplaces, only allowing essential services to carry on. There was a closure of schools, restriction of movement, restriction of gathering, closures of gyms, swimming pools, and suspension of exercise classes. Mandatory use of masks was introduced on the 14th of April. Then schools slowly resumed face-to-face classes in smaller groups, and then safe entry was introduced. And gradually, that resulted in the opening or lifting of circuit breaker measures. Now, what we are experiencing today is not as drastic as circuit breaker, although some restriction measures are in place. So working from home is the work arrangement by default. Essential services are still allowed on campus. Research activities that cannot be carried remotely are also allowed to take place on campus. So we have researchers, lab-based researchers who need to carry out their work on campus, to be on campus, to be in their labs, to do their research work. Contact tracing now can be carried out very fast through the Universe app and through the use of Trace Together app. How would Circuit Breaker 2, if there's one, be carried out differently? I think we still need to go back to the fundamentals of really having separation, having the safe distancing measures in place, reducing the intensity of the interaction, the duration of the interaction. We should always emphasize on hand hygiene and keeping the place clean. If we were to do circuit breaker again, what else would we do differently? I think communication is very important. Clear communication is key to effective crisis management. We realize that communication to different groups of stakeholders need to be tweaked differently, need to be addressed differently. Communications to the students, to the faculty members, academic staff, admin staff, researchers, as well as non-NUS staff who are on campus. The message needs to be adjusted accordingly. What we could also do a bit differently is to have predetermined actions that need to be taken under different situations so that it will help in terms of communication, how we can communicate clearly and effectively.
Any concluding thoughts for our Phoenix audience?
It is important, again, to go back to the fundamentals. To prevent someone from getting infected, okay, you need to bear in mind these fundamentals. Firstly, it's important that everybody wears the face mask. Remember about hand hygiene. Wash your hands frequently and keep a safe distance from the person next to you. The next important point is about vaccination. If you are eligible for the vaccination, please go and get yourself vaccinated. The vaccine will not only afford a level of protection, but you also reduce the severity of the symptoms if you are infected. We need everybody to work together to keep the community safe. So we should all do our part so that everybody can be safe. Thank you.
As we bring our webinar to a close, we once again thank you for following us and hope that this talk has given you a better insight of the situation around us and how NUS has responded quickly to the changes. This is Athena Tan. Let us stay safe and healthy. Goodbye.